Hi, my name is Ashley Suzanne Sedlett, and I will be doing a skin, hair, and nail assessment. And I will also be doing a head and neck assessment. This is my husband, Anthony. He's going to be helping me out today. Okay. First, I am going to assess the skin. And what I'm looking at right now on the arms, the skin is pink in a normal color. I'm just going to feel for the temperature there. Skin is warm and dry. The pigmentation is even and the skin is smooth. There's no swelling and there's no edema. And have you noticed any color changes in your skin anywhere, like moles or anything in the arms?
No.
Okay. And I'm going to give the skin a little pinch there, and it bounces back. There's really good skin turgor. And I'm going to take a look at the legs as well. Don't think you can see it. The skin of it's okay. The skin of the legs is also warm and dry. I don't notice any swelling. There's no edema when I push in the feet and legs. I'm going to check the fingernails. The fingernails, have you noticed any ridges or any breaking or anything like that?
No.
No. I'm going to check the capillary refill. Capillary refill is brisk in the fingers. And then I'm going to also check the toes. It's also brisk there. Have you noticed any ridges or breaking or anything with the nails of the toes? No. Okay. And some things that you want to look for with your skin, there is A, B, C, D, E, and if you see any like spots, moles, places on you, you want to look for asymmetry in those, and meaning that they look different on the other sides. And you want to watch the borders. They're supposed to be like rounded, have even borders. And you want to watch for color changes. So if you have a brown mole that suddenly turns black or dark like blue or anything, you want to watch for those color changes. And diameter, moles that are larger than 6 millimeters, you watch out for those. And then if you have any changes in like elevation or enlargement, so if it like grows upward, gets bigger, it's something you might want to have checked out. I'm going to move on to my head and neck assessment. And what I'm looking at right now with the skull is to see that everything is symmetrical. The eyes line up with the ears. I'm currently not seeing any bumps or lumps, anything like that. Have you noticed any like bumps, lumps, anything out of the ordinary with that?
No.
Okay. Taking a look at the eyes and the eyebrows, they're all symmetrical. Can you give me a good smile? Sorry. Wonderful. Good symmetrical smile. I'm going to palpate the temporal arteries. Good. And then I'm going to palpate the jaw. Go ahead and open and close your mouth for me. Very good. Have you noticed any popping or locking with your jaw when you open and close your mouth? Okay. Just looking at the general face, I don't see any like puffiness or edema, anything like that. I am going to inspect the nose. Can I lift your glasses up for just a second? Okay. Is there any tenderness or anything around? Appears to be symmetrical and straight. Can you breathe through both sides of your nose or your nose painting? Well, good. Well, perfect. Okay, have you noticed any drainage or anything like that?
No.
No. Thank you. Alrighty. I am going to take a look. I should have left it on. Don't see any redness or any drainage. It's pink. There's no deviation, no polyps. I didn't see any bleeding and no swelling. I'm going to palpate the maxillary and the frontal sinuses. You feel any tenderness there?
Nope.
Any pain, tenderness?
No.
Okay. And I am going to feel your trachea here. Go ahead and give me a good swallow. Okay. And I'm going to feel for the thyroid. Just swallow. Okay. Okay. I'm going to have you tilt your head back for me, all the way back, and then forward, and back up, and like side to side. Can you turn your head like no? Any pain, tenderness anywhere in your neck when you do that?
No.
No? Okay. Wonderful. Okay. Now I'm going to palpate the lymph nodes. I'll be palpating for the preocular. Let me see that. And the postocular, the postoccipital, the jugulo-digastric, and under the chin for the submandibular and the submental. I'll be palpating for the superficial cervical and the deep cervical chain, the posterior cervical, and then for the supraclavicular. Alrighty. Can I see your teeth? Give me a good smile. Perfect. All the teeth are there and intact. Don't see any cavities right off and any occlusions. Any fillings in the back there. Do you care to stick out your tongue for me? Okay. The tongue is not coated. It's pink and moist, and up underneath is good and moist and pink. Okay, thank you. I am going to put on some gloves, and I'm going to check your teeth and your gums. Are your teeth tender? Oh, teeth. Are your teeth tender anywhere?
Yeah.
Okay. Alrighty. And with your gums, just going to take a look and feel any lesions that you know of? Nothing? Okay. I am going to take a look at the back of the throat and the, you don't have your tonsils anymore, correct?
That's correct.
Okay. Just gonna take a look here. And I see the uvula. I don't see any exudate or redness. There's no tonsils to be seen. I don't notice any redness, swelling, or drainage. And I believe we've got it covered.
Okay.
Okay. Hope I can splice that off there. Okay, I had forgotten to do the hair. Throughout most of the body, there is thickness of the hair. It is evenly distributed throughout the body and on the face. On top here, we have thinning and patches of baldness back here in the back. So the hair up on top, while it's getting thin.